geriatric center measures. These bills, including one of the bills by Senator Erwin, these bills aim to establish Philippine geriatric centers in the country to provide specialized, dedicated care to our growing senior citizen population.
Bago tayo magpatuloy, huwag kalimutang mag-subscribe sa aking channel. Thank you sa pag-click ng aking video. Good day po sa lahat ng mga nanonood. Sa mga bagong viewers at napadaan lang, by the way, I'm Tita Eda. Welcome to my channel. Ang channel na maghahatid sa iyo ng dagdag kaalaman tungkol sa government services, bagong mga balita at informative videos na galing sa legit na resources. Mag-subscribe na para updated ka.
Geriatric center measures. These bills, including one of the bills by Senator Erwin, these bills aim to establish Philippine geriatric centers in the country to provide specialized, dedicated care to our growing senior citizen population. While the rise in non-communicable diseases, dementia cases, and mobility-related health conditions among senior citizens, while these are rising, it's high time that we scale up our institutional geriatric care. So again, first, we'd like to hear from DOH at pati na sa National Center for Geriatric Health. Ano po yung current challenges sa elderly care? Ano po yung inyong mga geriatric programs? And we have the society here also. At ano yung mga proposals ninyo, no, in line with the measures being deliberated by the committee? So will it be, it will be Dr. Lauderes? All right, Doctor, please.
We strongly support the establishment of the geriatric facility. However, po, Madam Chair, we strongly advocate for creating separate and distinct National Geriatric Center Hospital rather than converting the existing National Center for Geriatric Health because of some concerns, because nasa loob po kasi siya ng Malacanang. There's some ang limited accessibility ng facility, and the Malacanang compound restricts access for general public. So we believe that a new strategically located facility would better serve the needs of the Filipino. Because 25-bed capacity lang siya, so ang location sobrang liit. But with a distinct separate entity, we can be able to at least have 100-bed capacity for the hospital. Maraming salamat po, Madam Chair, and Your Honor.
Salamat, Dr. Lauderes. Kalagay nga dito sa mga bills naming 2 at 8 pa, dahil itong Philippine Geriatric Center ay priority ng DOH. Nakapag-scout na ba ang DOH sa lugar na pwedeng pagtayuan nito? At paano nyo na-envision ma-implement ang ganitong klaseng batas? Halimbawa, Yusek, yung isang dating POGO hub dyan sa may Asiana, pwede bang doon ang Philippine Geriatric Center? Or kung sa iba pa?
Madam Chair, for the information lang po, all the DOH hospitals are covered by the regional specialty bill. So, mandatory po to the DOH hospital that there should be a geriatric ward. And nagiging problema lang po natin, the geriatric specialists are not that many po to cater these geriatric patients. But there are also IM or cardio in that specific regional hospital na pwede pong mag-alaga for the geriatric. So, it's still on process po, and maybe fundings din po for the DOH hospital that we need the separate ward for the geriatric patients.
And so nakapag-scout na ba kayo ng lote o location para dito sa Philippine Geriatric Center?
At the moment po, for the Philippine Geriatric Center, wala pa po siya. But we welcome that idea if it's possible with our legal and the health. There's a division po kasi in the department who study if it's in the health development plan of the Philippines and where exactly saan siya dapat malugar. But for the regional hospitals po, may ward po tayo dedicated for the geriatric patients.
Yes, I understand about the wards. Pino-follow up ko lang yung dahil priority na rin ng department itong subject ng 10 bills namin dito sa Senado. And I recall lang na yung na-raid na POGO hub dito sa Pasay, parang a couple of floors, Sen. Erwin, dating Sec. Erwin, ay tinurn over sa DSWD bilang additional office space sa kanilang mga program implementation. So please advise us kung meron eventually kayong mas malocate na possible location nitong Philippine Geriatric Center. then could I start from this side naman po sa mga resource persons natin? Well, I ask everyone, pakisubmit po yung position papers nyo on the Philippine Geriatric Center bills. Pero kung merong resource persons na may major recommendations or proposed amendments sa bills na ito, could we hear from you now? All right, Yusek Emiliza for the...
Madam Chair, Your Honor, we would like to propose that the oral health of each geriatric be of concern to the honorables because ito po nga ay isang parang sequel of everything. If you cannot eat, then you will be malnourished. And if you're malnourished, hindi ka rin po magpo-function ng tama. And apparently, the oral health in the entire Philippines is not given that priority in terms of budget and pansin. Hindi po siya nagiging equally important as the eye, equally important as the heart. Well, in fact, the WHO promotes that no health without oral health. So I urge na para po i-include din siya and that PhilHealth, who is our national insurer, would also include the dentures as part of their coverage. Kasi sa MAIFI po, we try to include it in the special provisions, but then hindi pa po ready yung DOH for the accreditation of the dental facility. So yun po yung hinihingi ko po because with our data, only 21.26 of all senior citizens in the Philippines are given the basic oral health care. So, napakababa po, but this is equally as important as other parts of the body dahil yung mga hypertension po, natatanggal na rin ng ipin or nagkakaroon ng problema with the gums and then bleeding gums, pag ganun din po ang diabetic. So, lahat ng non-communicable diseases are expressed in the oral health. So sana po hindi din po siya bigyan po siya ng pansin as budget and equally important kasi po sa DOH under lang po siya ng disease prevention. There's no specific bureau dedicated for the oral health. Kaya among the Western Pacific region, which the Philippines is included in, ang pangit po ng ating location with regards to the oral health. Thank you, Madam Chair.
Thank you, Yusek, and well noted. Mapag-uusapan din yan sa last topic natin after we conclude this part on the assistive devices to include dentures. Before I go to our resource person starting on my right, yes, Asek sa
Madam
Kilabon.
Chair, just a quick interjection and manifestation, Madam. On the part of the DOH, we also suggest that the functions of the Philippine Geriatric Center shall align with those outlined for National Specialty Centers under RA 11959. Currently, it is the Jose Reyes, including clinical service delivery, research, training, and coordination with relevant professional organizations as further defined in the implementing rules and regulations, Your Honor. That would be all, Madam Chair.
Salamat, Asek. That's helpful. Para kung aligned na dun sa pagkakilanlan natin sa National Specialty Centers. Thank you po. Alright, so our resource persons here, meron po bang major recommendations or proposed amendments sa ating Philippine Geriatric Center bills? Sino po sa inyo ay mayroon? Yes, Miss Emily of COSE.
Yes, thank you po, Madam Chair. Actually po, maganda, we fully support the bills on geriatric center. Kasi based para my experience po, for example, we have one in Bicol region, in Camarines Sur. So malaking tulong po talaga sa mga nakatatanda. So talagang may specialized services for older persons there. Kaya lang, I also want to support the recommendation po of Senator Tulfo na sa RA 9994, ando doon na po na dapat lahat ng government hospitals may geriatric wards. Unfortunately, kinakabit lang po din nila sa ibang wards. So hindi po talaga siya fully nakahiwalay. And at the same time, napakaliit po nung capacity. Like 10, 5, ganun lang po. May mga hospitals po based doon sa nakarang hearing na attendang ko at last time. May sinasabi po sila na parang may allocated lang na 10 beds. So, kulang na kulang po talaga. So, though dilalabi natin na ma-push po itong bills na to, pero mas magandang strengthen din muna yung current na law na hindi pa po fully na-i-implement. So, yun lang po siguro, Madam Chair, yung aking recommendation for now. Thank you.
Thank you din, Miss Emily. Actually, yung recommendation nyo ni Senator Erwin, pwedeng sunrise provision yan eh. Parang phase, no? Phase transition from ward to regional specialty center. to yung National Geriatrics na. So need lang po dyan na i-tighten yung service delivery network, yung pillar na yun ng ating universal healthcare. So salamat po. Yes.
Idagdag lang po na ensure lang natin yung integration ng services sa primary healthcare and community-based na mga initiative na po na ginagawa para fully ma-respond talaga yung needs po ng mga older persons. Kasi usually po kasi yung ating, for example, mga barangay health workers, ang focus nila more on maternal and child care. So yung geriatric care po nakakaligtaan. Baka po, though alam ko may mga initiative na din po yung DOH, nakakapag-attend ako sa mga workshop, na unti-unti na rin pong tinetrain yung mga barangay health workers on geriatric care po. Yun lang po. Thank you.
Thank you ulit, Miss Emily. Definitely, integrate sa primary healthcare. Yun naman ang thrust ng UHC, di ba? Tapos community-based, kaya na-appreciate ko yung best practices na sinabi ni Dr. Jalderes kanina, nakasama po yung ganyang community-based na thrust. So from this section ng mga resource persons, sino po ang may major recommendations at proposed amendments sa bills? Yes, Ms. Angelica for League of Provinces of the Philippines.
Yes, Madam Chair, kasi it was already mentioned by Senator Tulfo kanina na sana masama ang mga provincial and district hospitals. So, ang siguro namin, one of the first things that must be done is really to train the cadre for the geriatricians as well as the allied medical personnel, and then to give incentives for them to be willing also to serve in the provinces po, outside of the regional areas. Kasi yun yung nagiging problema din ng LGUs eh. We cannot get the specialists to go to the far-flung provinces po. Mas gusto nila doon talaga sa metropolitan centers. I think around 60% ng mga geriatricians natin are in NCR. So, gusto natin ma-move sana sila outside. So, I think it's a system, we come up with a system of incentives really to get them to stay in to get them to train, stay in the Philippines, and work outside the metropolitan centers. Thank you po.
Thank you, Ms. Angelica. Baka pwede nating pagtrabahuan with the committee yung usapin ng incentives. But quickly, meron na bang partnership with DOH at saka yung society siguro sa League of Provinces to work on this? Wala pa po. So, essential pillar din ng UHC, no, yung ating health human resources. So, very well noted for work.
If sa tingin mo, natulungan ka ng video ko na ito, nakasave ka sa oras mo, you can click yung thanks button at any amount ay malaking help sa pag-grow ng channel ko. Yun lang po muna ang aking update. Sana ay nakatulong na dagdag kaalaman ang aking shinare today. Ang goal ng aking channel ay mag-create ng awareness. Kung ganitong mga topic ang gusto mo, panoorin mo ang mga videos ko na ito. Thanks for watching! Kung may kapamilya, kaibigan o kakilala sa tingin mo ay magiging interesado sa video, please share or tag sila sa comment section. At syempre, if nagustuhan mo ang video, i-like mo na ito at subscribe ka na din. As always, feel free to write your questions, comments, and opinions respectfully. And continue to be a blessing and stay safe!